Hi, everybody. Welcome to the PermanenteDocs Chat. I'm your host, Alex McDonald. Again, I practice family and sports medicine here in Fontana, California, and I'm part of the Southern California Permanente Medical Group. So thanks all for joining in or tuning our first episode here of 2023 from wherever you may be watching or listening. Be sure to check out the Permanente Medicine YouTube page or wherever you get your podcasts to listen to this or past episodes as well, too. I am very excited for our first guest this year. Dr. Fonda Mitchell is an OBGYN doctor from the Southeast Permanente Medical Group. And in honor of Martin Luther King Jr. holiday on Monday, we'll be discussing the career and the challenges of our Black physician colleagues and also how this impacts health equity as well, too. So I'm really proud. For the first time ever, actually, Martin Luther King Jr. birthday is actually a holiday here at KP. So I'm very excited. So if you're listening live, you have questions, feel free to drop them in the chat. You'll put them in the Q&A and we'll get to as many as we can. So Dr. Fonda Mitchell, thank you so much for joining us. Let's just jump right in. Tell us who you are and what you do.
Hey, Alex, thank you so much. Thanks so much for having me. I am an OBGYN with the Southeast Permanente Medical Group, and I have been with Permanente now for 21 years, and they have been a very, very fun-filled 21 years, a lot of challenges, but things are great here in Georgia. I am the physician director for our government relations program, as well I function as an elected board rep for TSPMG.
Great. So we have lots of things to talk about. Many of you know that I'm passionate about government relations and health policy, so we could always touch on that too as well. But I want to hear more about your story and how you end up with a career in medicine.
So I am the product of two science teachers. And so science has always come, I wouldn't say easily, but it's been something that I've had a strong affinity towards. And so as I kind of looked at career paths, education, medicine, research, those things, really were top of mind. And I had the opportunity while I was in college to shadow a physician in our local community who happened to be an OBGYN. So I was able to work with him a little bit in his office and accompany him on rounds in the hospital, and observe some of the surgeries, minor procedures, as well as accompany him during some of the deliveries. So I really, really enjoyed the aspect of the care that he provided. It really wasn't until I got to medical school that I decided that I too wanted to be an OBGYN. But that was my introduction to medicine, and it's made, a great impact in my career choice and how things have proceeded so far.
Excellent. Very nice. Well, can you share some of the challenges you experienced as a Black female physician? And also, what are some of these challenges that still exist today for our Black physician colleagues?
So I'll tell you a little bit about my entree into making a medical school choice. So I am a graduate of the University of Georgia, and many of the graduates there either went to the Medical College of Georgia or Emory University for medical school. So as I applied to medical school, I was accepted at MCG, but then I kind of thought about, did I do myself a good service in applying to different medical colleges that could probably better serve my needs or help me better serve a different patient population, an underserved patient population? So I included in my application a program for Morehouse School of Medicine. So I was accepted there, and it is a nice little microcosm that kind of gives you exposure to a diverse academic background. It gives you a group of colleagues that are diverse as well too, culturally as well as geographically around the state of Georgia. So it made it very nice, a nice little cocoon to have as you struggle through different aspects of, the challenges of becoming a physician.
Mm-hmm.
And so many of my colleagues, we still practice here in Metro Atlanta.
Mm-hmm.
And as well too, we continue that mission of the medical school to provide care to the underserved.
Yeah, absolutely. Absolutely. Now we know that patients have better health outcomes when their physician looks like them, speaks the same language, has the same kind of cultural background as well. And we are, how do I put this? Like we don't have enough physicians in this country who can relate to some of our Black patient, our Black community as well too. What types of things do you think we can do to sort of improve the pipeline and encourage and support our younger individuals to go into medicine who maybe don't necessarily see someone who looks like them in a career in medicine?
So when we look at the population of physicians across the nation, Atlanta looks very different. There is a large professional population of minorities where there are nurses and healthcare providers and physicians. And so when we're here, we don't really see as much of that, where you don't have the people who kind of represent you out there. So
Mm-hmm.
it looks a little different here. But when you go out to other conferences or other regions, things do look a little different. And sometimes we take for granted that our medical group here has a large proportion of Black physicians. So we spend as much time as we can with our patients. We try to help them understand that, we are here for them, that things can sometimes be a little challenging, and make sure that they understand that they have someone that they can communicate with. There are different aspects of the things that we do that can make things a little challenging. So in Georgia, we discussed earlier that there is a significant maternity morbidity challenge here as we take care of our patients. So one thing that comes up more often than not lately is, as a Black female OBGYN, I take care of a lot of moms who have critical needs. And when you walk into a room, it's almost like this big sigh of relief that you are there, that you're going to take care of them, and that they're going to have a healthy, happy outcome. Mm-hmm. On the opposite of that, you feel that their concerns are, if you are not there, that there's going to not be as healthy an outcome. So you want to ensure the patients that, I have colleagues that are wonderful, who are going to take great care of you, and we're going to do the best as a team to provide your care.
Yeah. Does that lead to more stress on our Black physician colleagues who feel like they need to show up more, or they need to go above and beyond? And does that increase the risk of burnout amongst those physicians as well? Tell me more about this.
So there can be a lot of pressure with that. There can be a lot of challenges that are there, because the patients feel like, their well-being, their life, their child's health is in your hands. So that pressure is there to kind of stay and make sure everything has a good outcome. And sometimes we know, sometimes you do all the right things, and unfortunately, some bad outcomes can happen. Mm-hmm. Our current practice here in the Metro Atlanta areas, we take call-in shifts. So when your shift is over, if the patient is undelivered, there can sometimes be that expectation that, but of course you're going to stay, but of course you're going to continue to be here to take care of me through the birth of the baby. I am very fortunate that I work with a wonderful team of physicians and a very a diverse group of physicians and midwives that provide excellent care. So between all of us, we try to let our patients know that, we're going to be there for you. And I think, when we have these conversations, that I'm transitioning you to a partner. And a lot of the times it's even better if that partner happens to be another Black female, either my midwifery colleague or another physician colleague, that you can make the patient continue to feel comfortable. But they need to feel comfortable with all of us. But yeah, there's a time when that burden is a little extra, when a patient's, have certain expectations of the care that they're going to get, and not that they shouldn't have expectations.
Right. Exactly. I like that word, midwifery. Just try saying that 5 times fast. Anyway, I digress. What are, I'm a white male, and I have no idea what it's like to be a Black physician. What are some things that myself and my other colleagues can do to be an ally for our Black physician colleagues who often may deal with some stress or some ongoing challenges which we can't even see? So what are some things we can do to be better allies?
Well, we have a great team that works with our equity, diversity, and inclusion. Mm-hmm. And I really feel that just seeing each other as peers, mm-hmm. Just understanding that there's not a lot that really divides us. When it comes down to it, we all went into our respective careers for similar reasons. We want to take care of our patients. We all have been successful at doing that because we put in the hard work. So I don't know if there's really as much contrast as there is. Diversify your friend group, mm-hmm. diversify your peer group, and get to know each other as individuals. And the partnerships can only get stronger from that, and you can work better with your colleagues.
Yeah. And that reminds me, one of the best parts that I love about being a member of the Permanente medical groups is just the diversity we have amongst our physicians as well, too. And, despite how people try to divide us, we have much more in common than we have in difference as well, too. So that's a great reminder.
When we walk into our hospital partner department meetings, it is very obvious who brings the diversity. It's mm-hmm. Permanente, because the room looks different until we enter. And when we enter the room as a diverse body of colleagues, then the knowledge that we bring, our personal experiences, the stories that we tell, our patient populations, it makes all the difference in the world when it comes down to health policy decisions, administrative decisions that happen in the hospital, and how we take care of our patients.
Yeah, and that's absolutely so well said. And this might be a good time to actually bring up a really interesting initiative that's being done in the Northwest Permanente medical group right now. They're actually creating a center for Black patients and Black physicians as well. And they're actually looking for a physician lead of that new center as well, to really work and delve into some of these EID issues as well, too. So maybe a little bit of a plug for our Northwest Permanente colleagues out there. But there's so much work to be done here, both on an individual, but also a systems level as well. And I'm so proud to be attacking this from multiple different angles as well, too. Is there anything specific that your EID program is doing there in Atlanta, in the Southeast Permanente group, that you're particularly proud of, or that's particularly, you think, kind of outside the box thinking?
Well, we are currently doing a lot of surveys. We're asking questions, and we're giving our medical group partners the opportunity to put things at the forefront that may not have been top of mind for leaders. So things that are impactful in how we address issues that present themselves. As we dealt with a lot of the social unrest that happened over the past year or two, it had a lot of people thinking, had a lot of conversations that may not have happened organically before. So those conversations are happening so that members within our medical group feel that they can, express themselves or seek out opportunities to identify problems and how they would like for them to be addressed. Because many times you don't know if somebody doesn't feel comfortable having the conversation or elevating that topic.
Yeah, psychological safety is so important, and creating that culture where you can speak up, be about race, cultural issues, patient care issues as well too, regardless of who the person is in the system. I think it's so important that we all feel comfortable and have a voice as well too. So that's phenomenal to add that as well too. So again, if any folks have any questions on the Zoom right now, you can drop them in the Q&A. We'll try and get to them as well too. I want to go back real quick, Fonda, to something you mentioned prior about policy and health policy, and kind of getting outside the bubble of Permanente sometimes as well too. Now, first of all, congratulations. I understand you're starting your term as the president of the Medical Association of Atlanta. Is that correct?
Correct.
Yeah.
Thank you so much.
So tell us more about that role and those priorities, and how your work within Permanente and with the Medical Association of Atlanta kind of plays off one another as well.
So thank you for that. We have a large contingency of physicians that are actively involved in our local medical society. And again, we bring a wealth of diversity in practice styles so that our colleagues out in the community understand who we are, how we practice, and dispel some of the myths that, we are people who couldn't make it in the world of private practice. Well, no, we have a different practice style. We're able to take care of our patients, and we are an integrated team that works collectively to take care of our patient population. So as we approach different topics that happen through the medical society, we bring a diversity in how we manage those things. So currently, our legislators are in session. So we have doctors that go down to the Capitol and do testimony towards how we can better care for our patients. We have challenges with populations within our state that are underserved, like a lot of our nation. You don't have to go that far outside of Metro Atlanta to see the difference in access to care. So within Permanente, we take care of patients within Metro Atlanta and some of the perimeter parts of Atlanta. And we talk to legislators about who we are, what we do. And that brings about a better understanding of how we can, be helpful as we look at opportunities to expand healthcare delivery around the state. So our physicians are really, really vocal about how important it is to provide care for Georgians. And we are out in the community and just demonstrating how important it is to provide that care.
Yeah, now you're definitely speaking my language, wearing my health policy, government relations hat. It's so important. Elected officials sometimes have no idea what it actually means to practice medicine. And we really need to take our stories and advocate both, individually, it's great to advocate for patients, but on a systems level and a state level, it's even more important as well too. Do you have any physicians who are in the Georgia legislature at this point? Do you know? Because we actually just elected one of our own physicians to Sacramento, to the assembly here in California, which is just so exciting as well too. I'm curious if that's similar in other parts of the country as well.
So physicians within our state legislature, yes. No Permanente physicians as of yet.
All right, we'll work on that.
Yes. That is another pipeline that I'm working diligently towards. But we do have a physicians caucus at the state legislature in Georgia. So we've got 2 senators, 2 representatives, and we work very closely with them because I think 2 are still practicing. the members in the House, and then the members in the Senate have retired. So, they come with different perspectives, but they have a good understanding about what it is that we're trying to accomplish. So they speak our language. We try to be a voice for them. We try to be a resource for them, and, work every day to bring more physicians to our legislative body to, make sure that our members here in the state are taken care of.
Absolutely. Absolutely. We have a question here in the chat. Actually, I want to switch gears a little bit. This is a really good question. What are 2 to 3 personality traits that we can all authentically and intentionally live and reflect to our members and their families so that we can create a level of comfort as members of that same community, and when we're not part of that same community, but still feel connected as well? So I'm paraphrasing a little bit there. I hope I did the question justice. So what are those personality traits or things that we can really kind of reflect and live ourselves? So
first, I think we all need to work on being good listeners. There are opportunities where we sit there, we may hear what you're saying, and we're looking for our opportunity to kind of jump in, but we're not necessarily processing, what the actual needs of that family, that patient, what that is. And the second thing is some ability to empathize, to understand that it may not always be easy. We have a textbook on how things should be done, but that may not always play out in the real world when you don't have access to transportation and you don't have access to healthy foods. So to just kind of empathize and be, less judgmental. Sometimes clinicians can be a little judgmental if patients aren't, they're not following their script like you're following your textbook. Right, so exactly. Listening, adding some empathy, and just, I guess, overall, just kind of being open-minded to who comes through your door. You can be a little exhausted. We've got a lot of patients that we're trying to take care of, but just meet every person where they are and be open-minded to what dialogue is in front of you at that time. Really be present with the person, the conversation that's happening at the moment, because we can all be sidetracked by a lot of either personal things that you're dealing with, the last patient you just saw. Lord knows that in basket sitting there waiting on you after you finish 25 patients for the day. Yep. So, the world is full of opportunities to distract you. And I think we need to really just kind of zoom in and focus on what's happening at the moment.
Yeah, just be present and be in the state of flow with your patient. I love that. That's such a great message. Present. Yeah. All right. Well, last question, and we could go on and on, but we're going to have to try to wrap up here. So last question, what makes you most proud to be a Permanente physician?
Oh, I will say I cannot imagine doing what I do outside of this venue, outside of our practice model. I've worked in private practice before coming to Permanente, and, there are challenges with both sides of medicine, but here within Permanente, I am blessed with colleagues that I trust to maintain good continuity of care, who are there to bring new, fresh thoughts, ideas around how we practice. I've got established, seasoned colleagues who will tell you that, it feels hard now, but things will get better. We have new hires that are here that, are fresh and full of ideas that, things that I haven't even thought of. I've been practicing for 21 years. So, things sometimes get a little stale. So they bring, great ideas. And Wonderful. And having the specialist. So really, it is the wonderful population of physicians I get to work with. And I tell my patients every day, you don't have just me taking care of you. You got like 600 of us. Right. And we're all here to make you better.
Wonderful. Dr. Mitchell, thank you so much for joining us and sharing your expertise. We really value and appreciate your time.
Oh, thanks, Alex. It's great to be here. My pleasure.